Hi, my name is Shaina from BSN2D, and today I'm going to discuss the principles of recording in nursing. So before we will proceed to my discussion, which is the principles in recording in nursing, I would like you to know that why do I end up on picking this topic, which is the principles in recording in nursing. So I end up choosing it because for me as a student nurse, record keeping is one of the most special part of being a student, especially when you're already on your clinical duties, especially at the hospitals, in centers, and etc. So it's really important because you need to face a lot of patients in a medical setting, and you'll end up on forgetting some of those data. So record keeping is really important because we need it, of course, to lessen our stress and also to record those demographic data of the patient, the assessment that we've gathered to those patients, and also the proof of what we have discussed with the patient. And we need it most especially when the doctors will ask you to show the data that you have gathered from the patient. So for me, record keeping is really essential from those workers who works at the medical field, and of course to those workers also who was a teacher, a cook, and etc. So record keeping is really important in our life, and most especially in our work. So before that, we will proceed to our discussion. So we will proceed to my discussion, which is the principles in recording in nursing.
So good day, my name is Shaina Sotto from BSN2D. So this is my presentation or my discussion, which is the principles in recording in nursing. So before we will start, I would like you to know why did I choose this topic. So simple, because record keeping is one of those proof to lessen stress in your life and also avoid typographical errors, especially when you're working. So record keeping is really important in all aspects of work, like being a cook, a teacher, and a nurse. Especially when you're a nurse, tons of paperwork is one of your first priority. Well, of course, you really need to prioritize those data and to keep it on record to make it easy to find when it's needed. So I would like to give an example scenario. So, a patient with acute ulcer stated that he had his previous medication and it doesn't help him rather to get better. For me as a nurse, we need to record it to have a data, of course, to show attended session to your senior nurse and coworkers at the hospital that this patient said it so. So record keeping really matters a lot at work. So in that case, the principles of recording is really important because when after attending patients and another patients, there's a moment that your doctor wants to know what you've had discussed with the patient and what you do, what the patient said. So record keeping plays an important role for you to be able to give it to the doctor that you've documented it And that's all. Record keeping is really important.